Join us now for Health for Life, brought to you by Hamilton Healthcare System. Today we're talking with Dr. Quentin Smith. Dr. Smith is the medical director of the Hamilton Medical Center's Emergency Department. Dr. Smith, thank you so much for joining us today.
Yeah, thank you for having me. I'm glad to be here.
I'm glad you are. Dr. Smith, can you tell us a little bit about Hamilton Medical Center's Emergency Department?
Absolutely. Hamilton's ED could be called the front door to the hospital. It's where most people come before they need a care, if need to stay in the hospital for whatever reason. We're staffed by board-certified physicians as well as a great team of PAs and NPs, all with extensive training and experience in emergency care. We're available 24/7, 365 days of the year. We're able to take care of a wide variety of medical and surgical problems, from simple lacerations to more complicated medical problems like a stroke or heart attack.
What a great emergency department you have, and we're going to talk about heart attacks and strokes later in the show, but you did mention that you guys are prepared for that too.
Absolutely.
Yeah, that's very good. Now, what makes Hamilton's emergency department different from the emergency departments at other places?
Hamilton stands out to me in several ways. One is that, especially in these days, like through the pandemic and afterwards, sometimes even more so, a lot of hospitals struggle with boarding, which is when a patient, comes to the emergency department. They're sick enough that they need to be hospitalized, but unfortunately there's not a staffed inpatient bed available for them to go to. So that results in a patient remaining or boarding in the ED until a bed becomes available.
Okay.
And at some places, sometimes that means that they can be in the emergency department waiting for 24 hours or even more.
Really?
That's the way it is,
Wow.
unfortunately.
At some places.
At some places.
Yeah.
And when that happens, that means, there's, one less bed in the emergency department to take care of new patients that are coming in, whether it's by an ambulance or through the front door. And then, we in the emergency department would have to adapt to this. And at other hospitals that I've worked at, that would often mean seeing patients, on stretchers in the hallway, on a chair in the hallway, sometimes even in the waiting room itself. And, this has become such a problem, even nationwide, that ACEP, American College of Emergency Physicians, sent a letter to the White House urging, the administration to convene a summit to address it, to get people to sit down and talk about how they can address that problem.
Right.
At Hamilton, thankfully, boarding is a very rare occurrence.
Well, that's good.
Yeah. So, and another thing that I love about Hamilton is the breadth and quality of care we can deliver. We're a designated Level 3 trauma center, accredited chest pain center with open heart capabilities, and a certified primary stroke center. And that means that only 1% of the patients that come into the emergency department at Hamilton have to be transferred to another hospital for a higher level of medical or surgical care that can't be provided at Hamilton.
Very, very impressive. Tell me a little bit more about what that means to be an accredited chest pain center with open heart capabilities.
Yeah, so there's a lot that kind of goes into that, but the kind of the short story is it means that we've got an interventional cardiologist and a cath lab team available on call 24/7, available to respond, within 30 minutes of somebody walking through the door with chest pain due to what's called a STEMI, or a kind of a heart attack.
Right.
And if that's the case, we in the emergency department will find that. We'll do an EKG and see the changes that occur with that, and activate the cath lab, as we say. And they'll go there and they'll perform a heart catheterization. And if they find a blocked artery, they're able to intervene, usually by placing a stent to open the artery up and restore blood flow to the area of the heart that it goes to.
Gotcha.
And in certain cases, for example, if they find multiple blocked or narrowed arteries, or some other indication, they can call on Dr. Morrison, who's a fantastic cardiothoracic surgeon, to evaluate for the possibility of what's called a coronary artery bypass grafting, or CABG, we say sometimes for short.
Now, I had a CABG.
Really?
I didn't know what that meant, but they said, well, he's going to get a CABG, and I got one.
Yeah, and all of this kind of happens really fast. As a patient,
fast,
you don't
yes.
realize, but kind of a lot goes into it because, the longer those arteries are blocked or the less blood flow going to the heart, then the more damage that can occur to a heart.
Well,
So,
I had the open heart. I had a five-way.
Yeah,
Five
vessel?
Five vessel, yeah.
Wow.
And that was back in 2013, and it was a CABG.
Yeah.
I didn't know why they called it that, but now I do.
Yep, it's an acronym.
What about that?
So in addition to, that availability of those people to do those surgeries and interventions. It also means that we participate in data collection, and community outreach and education, quality improvement projects, things to continually improve the care of cardiac patients. And since cardiovascular disease is a leading cause of death in the USA, that's a big deal.
What are some warning signs that we should be looking for when it comes to a heart attack?
Yeah, so it can be different for every person, but some typical or common warning signs of a heart attack can include things like pain or pressure in your chest, usually lasting for more than a few minutes. Sometimes that can be preceded by pain that's not as bad, but especially if you're exercising or physical exertion, those kinds of things making it worse, or can be red flags that could indicate that pain is because of an issue with your heart. If that pain is really severe, and if it's radiating to your neck, your jaw, your arm, making you short of breath, makes you break out in a sweat, make you nauseated or lightheaded, those are all definitely things that warrant calling an ambulance, or coming to the emergency department, and getting checked out, because it could be something serious like your heart.
Definitely. Take care of that. Take care of your heart. Okay, now it's good to know that, but let's change gears and talk about a stroke. What are some of the warning signs that someone might be suffering from a stroke?
Yeah, so a stroke, besides the heart attack, is another kind of time-sensitive diagnosis that needs to be identified and addressed very quickly. We say time is brain in the setting of a stroke. So things to watch out for. There's once again another acronym. In medicine, we love acronyms. For a stroke and signs of a stroke, things that you can look out for, we use the B FAST or BEFAST to kind of remember signs or symptoms. So B for balance, and is there a sudden loss of balance or coordination? Are you feeling like the room's spinning for no reason? E is for eyes, and is there a sudden blurred or double vision, sudden persistent vision trouble, your vision goes out, things like that would be reason to think, is this a stroke, and get checked out. Moving on to FAST, F is for face. You can ask somebody to smile, and if one side or the other is drooping, if it's no longer symmetrical like it should be, could be a stroke. Arms, asking the person to raise both arms, and if one side, is not as strong, if it's drifting, if there's weakness or numbness on one side, once again, think stroke.
Got you.
Speech, does the person have slurred or garbled speech? Can they repeat simple phrases? And then T for time. Like I said, time is brain. And if you have these symptoms yourself or with someone that's having these symptoms, the best thing to do is call 911 for immediate medical attention so that they can get to the hospital as quickly as possible. If somebody is having these symptoms, somebody's having a stroke, it's usually due to, once again, a blockage of an artery. And there's a medication that can be given if it's done soon enough. If it's done after, hours, days after the symptoms start, then it's more dangerous than helpful.
Yeah. Now, is this what I've heard called the clot blocker or the clot killer?
Clot buster. Sometimes people talk about it.
I've heard that. Yes.
Yep. And so, as soon as you or anyone that you know or see has those symptoms, like I said, call 911 right away.
Now, I know there's something about your tongue, I've heard.
Yeah. Once again, one thing that you can do is you can stick out or ask somebody to stick out their tongue, and if they're not sticking it out straight, if it's deviating to one side, it could indicate that, once again, that there could be a stroke.
Wow. What about that? I never thought about that. Well, Dr. Smith, are there things that I can do to reduce my risk for a stroke or for a heart attack?
Definitely. And a lot of the risk factors are the same for both of those. And while some things like your family history of heart disease or stroke or things like that, other medical problems, are out of your control, there are what we call modifiable risk factors. So things like your blood pressure, diabetes, blood sugar, and whether or not you smoke can significantly affect your chances of having a stroke or heart attack. Not to mention, COPD or other lung diseases, and basically every kind of cancer. Smoking is the leading cause of preventable death in the United States. So if you smoke and would like help quitting, you can visit hamiltonhealth.com/quit for more information about some of the programs that Hamilton offers to reduce smoking.
I understand. Now, we're so thankful to have Hamilton Medical Center's emergency department right here for our community. Thank you for sharing all this great information with us.
My pleasure. Thanks for having me, Bobby.
Thank you, sir. For more information on Hamilton Medical Center's emergency department, visit hamiltonhealth.com/emergency. In the event of an emergency, call 911. This program in no way seeks to diagnose or treat illness or to replace professional medical care. Please see your health care provider if you have a health problem. Thank you for listening to Health for Life, a presentation of Hamilton Healthcare System.